Kramer tells me that you are interested in an alternative to surgery.
Yes, yes I am.
So, funny story. I was shown this clip by my college roommate, and he actually believed that this was what I was going to college for, to become a holistic healer. Hey everybody, it's Dr. LeGrand here. I thought I would do an interesting video because there is a lot of misunderstanding of what is a holistic healer versus a holistic doctor, or a naturopath versus a naturopathic doctor. So I thought I'd describe this by my reaction of one of my favorite shows, Seinfeld. They actually have a clip where George Costanza goes and sees a holistic healer from a suggestion that Kramer had him go. So I'm going to go into this and kind of explain the difference of my reaction on this clip. So here we go. Ready? Let's get started.
Besides, what's it gonna cost me? 38 bucks?
So right there, I mean, this was a while back, but 38 bucks, even if a holistic doctor or healer, so a healer is usually somebody that might have just gotten their degree online, versus a holistic doctor or a naturopathic doctor, they have to go through accredited medical school to go through clinical rotations. Just like if you're going to any kind of medical school, medical practice, they have to go to a naturopathic medical college, versus somebody that might be a holistic healer or do Reiki or something like that. Usually it's through an online course. They don't have to necessarily do all the training, getting the hours working with patients one-on-one. So 38 bucks, it's not like that today. Even if a person who doesn't have a degree or does have a degree, people now charge, hundreds, 200s. I mean, it can go up to $400 an hour. So. Okay, this can be possible, but for professionalism, if you're going to see a naturopathic doctor, your visits are gonna, it depends, but really we're supposed to kind of try to keep with the HIPAA, compliance. You don't do passionate hugs. There could be definitely a lot of malpractice issues with this, but it really depends on the practitioner. Now, healers, on the other hand, since they don't really have, per se, a medical license, there's not as much jeopardy to this, so they might be a little bit more flexible. So, and again, this is a holistic healer, so.
Would you not put your foot on that, please?
Sorry.
Just from the get-go, he's a very good actor. He's trying to stay some good composure, very serious right from the get-go. Ah! Oh, wow. Now, I will say there is, when it comes to naturopathic doctors, even though they go through the extensive medical training, like I went to Brigham Young University, got my undergrad, did my minor in chemistry, got my major in psychology, and then had to do all the prerequisites of organic chemistry, biochemistry, biology, all the heavy sciences and math before I can get accepted into a naturopathic medical school. So I went to Bastyr University. Now, that being said, there is a lot of different people that come with all sorts of different backgrounds. So they might already have had experience with like Eastern medicine and other healings. So they might, once they get out of school, they might implement things like this. And I've known some doctors, that use the bells, sound therapy, stuff like that. So you'll see this from a naturopathic doctor, not just a naturopath. Now, a naturopath, like I said, is somebody that usually gets their degree online. And so they're not necessarily trained in a naturopathic state where it's been accredited. And there's about 23 different states. So you might not know that, but there's actually 23 different states that people can really only call themselves a naturopathic physician if they've gone to accredited naturopathic medical school. Anybody else, they're practicing illegally, they can't call themselves naturopathic physicians. Now there's other states that haven't licensed, and that's the problem, is they can still call themselves a naturopathic physician. Anybody can, as long as they got a degree online and call it good. And then there could be some really issues with practices. And that's what we're trying to push, is that make sure every state is licensed. Just like with doctors of osteopathic medicine, if you look at their history, they start out the same way, where they were trying to get licensed in each state. Now they're licensed in each state, and now there's surgeons that have who are doctors of osteopathic medicine. And so we're trying to push the awareness, and so that anybody who calls in a naturopathic physician has to have medical training from an accredited naturopathic medical school in order to treat patients.
What month were you born?
April.
You should have been born in August.
Awesome. Oh, wow. So even just things like this of playing into beliefs, I would say really, when it comes to treating patients, trying to keep beliefs or things that you kind of believe is not best practice, but you will see healers, people who call themselves healers, implement a lot bit more beliefs on certain things. So, but as a naturopathic doctor, really you're supposed to try to keep that separate, even though you want to kind of help them holistically, but try to not impose so much on your types of beliefs.
Your parents would have been well advised to wait.
Really?
Do you use hot water in the shower?
Yes.
Stop using it.
Okay, so this is very common. He didn't, of course, elaborate on this idea, but taking cold showers are actually really good for the body. It helps kind of really stimulate the nervous system, the circulation, get some to kind of wake up the nerves, and really good for it can help stimulate the immune system. So this is a common old practice that's, doing cold plunges. In fact, in Russia, they do this all the time, where they do the cold plunge in the middle of the winter to boost up their immune system, and they've found this to be really effective for people to boost their immune system. So just to tell people, stop using hot water and not explaining the purpose of using cold water, need to elaborate. A little education to the patient of why they would do that.
Okay. I'm off hot water.
Kramer tells me that you are interested in an alternative to surgery.
Yes. Yes, I am.
So, funny story. I was shown this clip by my college roommate, and he actually believed that this was what I was going to college for, to become a holistic healer. So I told him, Steve, wherever you're out there, if you're actually watching this, that if he ever comes into my practice, I'm going to do this on him. I'm going to do this exact scene on him, even though this is not at all how I treat my patients, but he really believed that this is actually how I practice. So it's hilarious watching this again. It brings back some old memories.
I think we can help you. See, unfortunately, the medical establishment is a business like any other business, and business needs customers. And they want to sell you their most expensive item, which is unnecessary surgery.
Okay, so I get this a lot. A lot of patients come in frustrated because of the medical system, but however, medical doctors are very proficient of what they do. If I cut my leg or, was in a severe acute situation, emergency situation, medical doctors are very proficient, know exactly what they do. But this whole concept that, it's run business. Yes, it's a business. The pharmaceutical bit, is a business. And there is a lot of debate between that. However, it isn't 100% where, they're trying to just get your money. They are trying to help patients out. And doing imaging is very important. And if surgery is necessary, can it be overused? Yes, of course. I think that's why it's good to have that balance. So as naturopathic doctors, that's why we have training in conventional medicine as well as alternative medicine, where I do prescribe medications when it is necessary. And I do send my patients out to get imaging done, refer to a cardiologist, and I have a lot of different MDs that refer to me because they say, go see your naturopathic doctor, because they don't have the training when it comes to, for example, drug and herb interactions. So we have that training because there's plenty of people that take tons of medications and tons of different herbs or supplements that can have interactions. And if you're not educated on that, like a lot of medical doctors are, because they don't have the training as far as herbs and supplements, because it's not really in the medical field. But in the naturopathic medical field, we do that training of trying to look at drug and herb interactions so that make sure our patients aren't having severe reactions.
Can I use hot water on my face?
No. I am not a businessman. I am a holistic healer. It's a calling. It's a gift.
Okay, so you will probably hear this term, and there's people that do feel like it's their calling to be a holistic healer, and I mean that's great. People, if they have that, totally pursue that. And you'll probably see that from naturopathic doctors. I know for myself, I feel like yes, it was a calling for me. I actually really didn't think I was going in the medical field at all until I came across my own naturopathic physician and just liked their approach of how they treated patients, but also still using conventional medicine because bringing those together to help out the patients. However, people like holistic healers or naturopaths that really just kind of go a little bit too far, what I call a little woo-woo sometimes on some of their practices and not trying to use science-based stuff, that can be a problem. And that can give a lot of us naturopathic physicians a bad rep. Now I know probably if some of my other colleagues are probably watching this, I might get a lot of bad comments about this, but that's just my belief. I really think in order to kind of unite us, the conventional medicine, Eastern medicine, and alternative medicine, we have to use things that are kind of more science-based for treating our patients, something that we can actually measure versus just kind of using things that our own beliefs or testimonials.
You see, it's in the best interest of the medical profession that you remain sick. See, that ensures good business.
Now, I do kind of believe that, in a sense, the pharmaceutical company, they are in the business to keep on using medicine. So in a sense, that might be an extreme, saying that, to keep you sick, but honestly, really, they are a big company, and to keep you on the medications, I usually work with my patients trying to get them off the medications, even off the supplements. I kid you not. I have patients that come in here with boxes of supplements and medications. And I'm like, no wonder you're not feeling well. Your biochemistry is out of whack. It has no idea what to do. It can't function properly. So my job is try to get them off the supplements as much, like whittle them down at least, just kind of more the essentials. And then of course, same with medications, of course, in a very healthy way where they don't have to rely on them so much.
You're not a patient, you're a customer.
And you're not a doctor, but you play one in real life.
So these are all to my commenters, the negative commenters, that I know this goes through their head, just like how Jerry Seinfeld, that you're not a real doctor. Now, again, explaining the difference between a naturopath and a naturopathic doctor. There is that big confusion is, yes, I actually went to an accredited naturopathic medical school. We have rotations. We see patients one-on-one. We do, also all these heavy sciences of biochemistry, anatomy, physiology, all the ologies, and then of course, we had cadaver lab, we had all the things that you would see in a medical school, and we did, pharmacology. We had to learn all about the drugs, how to use them properly, and then we had rotations where we had to see so many patients for our practice. So, but then versus a naturopath, usually it's a lot of just training about the naturopathic philosophies, medicine, and how to treat, but they don't necessarily have to have that interaction with patients in order to have a certificate in a naturopath. Or what I've heard is also natural medicine. I am a doctor of natural medicine. Again, that's probably just a certificate that they got online. They didn't go to an accredited naturopathic medical school to have that accreditation. Now, again, we are trying to push that every state that this is a requirement to be able to call yourself a naturopathic physician. So when patients are seeing an actual naturopathic doctor, they know they went to an accredited school, have their training, just like you would want for any doctor. So this is very important. That's just my 2 cents on that.
What about shaving?
You're eating too much dairy.
Okay, so it is very common to see, and in my own profession, that you will see a lot of naturopathic doctors like stop eating dairy, stop eating gluten, and this is wrong because everybody is different. In fact, even our own naturopathic philosophy is individualized medicine to kind of push that, oh, you shouldn't take dairy, oh, you shouldn't take gluten, that whole kick from all the documentaries that have been out there on that. And then just to have this feeling, oh, you should stop eating dairy. I kind of sense that in you. It's a bad rep for our reputation. And until you have actually evidence from some blood work or something that is viable information to really take somebody off of dairy or off of gluten, that's what I do. I have to make sure that it's actually viable information from doing some blood testing or doing an allergy scratch test, something that we can actually see and actually measure before diving in to assuming that you just need to be off dairy just because everybody needs to be off of dairy. But you will see that from any kind of healers, that just is a common buzz that's going around, which is really bad because, really honestly, it just shouldn't be that way.
May I?
I guess so.
Yeah, so Steve, I'm ready to do, place my hands on you, because he really thought this is what I would be doing, is, feeling energy and feeling. That's not the case. I don't do that. So, but, there is people that actually do practice energy healing. You might find some naturopath. I know some of my colleagues do that. More power to them. I don't personally do that. It's just, again, I like to do more science-based stuff for my patients to have some kind of measurement. But again, their background, they might have training in that and Reiki and other things. That's great, and it does help people. I mean, it is kind of more of the focusing on the mental emotional piece, and it doesn't work for all patients because it just depends on their beliefs, right? But trying to just kind of implement that, really it's not part of naturopathic medical school training. We don't sit there and do energy healing. It's just what the naturopathic doctor, their background might be, or if they've done additional training because they want to implement that in their practice. And I think that why a lot of people tend to want to become a naturopathic doctor, because they allow, in a sense, a little bit more outside of the box thinking. And I think that's why a lot of patients see a benefit from seeing their naturopathic doctor, because they spend a little bit more time with their doctor and are a little bit more flexible of working with their treatment for the mind. Because there's a lot of ways you could tap into the mind for the healing process, and whatever method that might be, as long as it's, within the HIPAA regulations, along with where it's, you're not breaking the law, but find that it's benefiting the patient because of their own beliefs and spirituality, that could be really beneficial to them if you want to go that. Now, of course, the doctor has to be comfortable with it themselves, and that's why I don't typically do it, just because my beliefs are a little different. So you'll just find that in different variances of different other naturopathic doctors.
You see? You are in disharmony. The throat is the gateway to the lung. Tonsillitis, adenoiditis is, in Chinese medical terms, an invasion of heat and wind.
There's some hot air blowing in here.
So there is, Chinese medicine. So the school that I went to, there's also an acupuncture program, and there'll be a lot of different healers that will refer to Chinese medicine. Now, I don't have a lot of experience in Chinese medicine. I might talk about different terms with Chinese medicine, but my training in Chinese medicine is very small. I look at more of the Western medicine and other alternative medicine practices. But you will see maybe some naturopath doctors that have a little more training about this talk about Chinese medicine. And it's definitely a different approach, and they still practice it a lot. And I mean, just for example, like they believe in Chinese medicine that the liver is actually really connected to the skin. So anytime that the liver is more toxic, you'll see that skin issues can be a problem. And so a lot of times I kind of like to address that when it comes to the liver.
I lived with the Eskimos many years ago, and they used to plunge their faces into the snow.
Can it be lukewarm?
Too much dairy? You really think I'm eating too much dairy?
So now you see that Jerry has his interest a little piqued to like, maybe I do have a dairy problem. And this is the problem, is that once you sell it to someone, like, you probably have a gluten problem or you have a dairy problem. First they're going to be like, oh, whatever. But then it kind of creeps back to mind. It's like, maybe I do have a dairy problem. And then you start eliminating it, and then the guesswork happens. But really, if you're going to find out if you have a dairy problem, you got to do the elimination diet, where you're eliminating it for a couple weeks and then reintroduce to see if the symptoms come back or if they eliminate during that time frame. But just to say that everybody needs to be off of dairy and gluten, it's not the case. But you can see that Jerry's definitely thinking in the back of his brain.
Your tea is ready now. This will solve.
I love the little triangle. I mean, whatever method that healers want to use around their beliefs. Again, This is not something I do. And by far there's not very many naturopathic doctors that do it. There is some. Again, it just depends on their background.
Solve your so-called tonsil problem. It's a special concoction. It contains cramp bark.
Cramp bark? Really? For tonsillitis. Cramp bark is actually used for people that have, women that deal with cramping during their cycles, during their period. Not necessarily used for inflammation of tonsils. It can help relax the muscles. That's why they use it for women that have severe cramping during their cycles. But using cramp bark for tonsillitis, yeah, that's a stretch. But maybe they just use that because it was a common term used back then. I don't know.
Love cramp bark. Cleaver. I once had cleaver as a kid. I was able to lift a car.
And some couch grass.
Couch grass and cramp bark?
Now, couch grass, if I remember that, it is the Latin term is Acelum repens, I believe, but that could actually, it is a demulcent, so it could be, I guess, beneficial for people who have a sore throat and a dry cough. That's what the demulcent does. It kind of helps increase more, mucus and flow into the throat and also for the lungs. Now, if he was dealing with more of a wet cough, that would not be a better option, because then you don't want to use demulsifying types of herbs if you have a wet cough. But if you have a dry cough, then yeah, by all means, can be helpful.
I think that's what killed Curly.
Go ahead, drink it, George.
Excuse me, Tor. May I ask you a question? You have intuitive abilities. You're in touch with a lot.
So you already see, Jerry's, very, very, very skeptical. I mean, he was very skeptical from the very beginning. But, I mean, if I was in the situation, I'd be skeptical to the extreme, especially from my background experience. I would have objections, like you've already kind of seen.
Cosmic kind of things. I have this note I can't read.
Now, I don't quite remember what the note is. If you guys could leave that in the comment section below. I can't remember. I'd have to watch the full episode again of what the background story of this is and why he wants to kind of interpret. Maybe he's testing him, so.
Wondering if...
Oh, yes. Mm-hmm. Cleveland 117, San Antonio 109.
So I think he just read it. Jerry was getting excited, like, oh, maybe he can interpret. I'm trying to remember if it was just a random note left to him and seeing if he could kind of interpret where it came from. Maybe that's what he wanted him to see. So now he's just like, well, you're not in tune if you don't know where it came from, so.
Go ahead, George, drink it.
Oh, geez.
That's not too bad.
That is very highly unlikely. Cramp bark or, couch grass, not good. Doesn't taste good. I don't know what George's taste buds are like, but it's not that tasty. Mm-mm. Okay, so it is very rare that I see, even for any patients that I give any kind of herbs, that you would have a reaction like this. I don't know, cramp bark and couch grass, that, especially turning purple. But it is possible, especially if somebody has a very high allergic reaction to grasses, then it's possible. But turning purple, that's a new one. I mean, of course, if you're going in anaphylaxis and not breathing, but he's screaming, it sounds like he looks just fine as far as his airway. So I'm curious why he would turn purple if his airway is fine. But so okay, so we'll just end there. But I hope you enjoyed this as much as I did watching this clip again from bringing back memories when I watched it with my roommate, who thought this is what I was going to go to college for, being a holistic healer. But I hope you guys now understand what the difference between a naturopath and a naturopathic doctor is, and between a holistic healer and a holistic doctor. Now, an MD can call themselves a holistic doctor because they probably did some additional training in more holistic medicine, alternative medicine, and there's plenty of MDs out there that do practice as holistic doctors. But I hope you guys enjoyed that as much as I did. Go ahead and leave a comment in the comment section below if you have any questions. And then if you guys would like me to do some more of these other reaction videos, maybe a holistic doctor approach of reaction on, I don't know, house, some of these other doctors like Dr. Mike that does that. Now, my residency training was more in a family practice. It wasn't in a hospital. So my reaction videos would probably be more on a perspective of what a holistic doctor thinks about maybe what these doctors are kind of pushing on their patients, maybe more of a patient perspective of what you should be asking questions are when you're in the hospital. So if you're interested in me reacting to these famous, TV shows like House, The Good Doctor's another one, and Scrubs, then I will do that. Just go ahead and leave that in the comment section below if you would want to. Give it a big thumbs up, and I will start doing those. So thank you for watching. Go ahead and share with your family and friends if you guys like this. Give us a big thumbs up. And then if you haven't subscribed to our channel, you can go ahead and hit this button right here to subscribe to our channel. And then any other kind of videos that you guys want to watch, I'll just leave them over here. So until next time, love you guys. This is Dr. LeGrand out. Thanks. Bye.